Chicago 1893. No antibiotics. No blood banks. No surgical masks as we know them today. And a man lies on a table, his heart has been pierced. The surgeon about to operate is told something chilling. If you touch that heart, he will die. Pause. Heartbeat grows louder. But the surgeon doesn't step back. He steps forward. This is a medical historical fact based on true story, no fiction. Before we dive into the main story, like and subscribe to our YouTube channel and click on the bell notification button for more interesting video like this. His name was Dr. Daniel Hale Williams, and what he did that day changed medicine forever. Daniel Hale Williams was born in 1856, just before the American Civil War. He grew up in a nation divided by slavery, racism, and violence. By the time he reached adulthood, freedom had been declared, but equality had not. Black Americans were segregated, excluded, and denied opportunity, especially in medicine. Medical schools rarely admitted black students. Hospitals refused black patients. And black doctors were almost unheard of. Yet Daniel Hale Williams refused to accept that fate. He apprenticed under a white surgeon. He studied relentlessly. He graduated from medical school in Chicago. But when he tried to work in hospitals, he was rejected. Not for lack of skill, but for the color of his skin. If doors won't open, build your own. In 1891, Williams founded Provident Hospital of Chicago. Became the first black-owned hospital in America. One of the first interracial hospitals in the U.S. A training center for black nurses and doctors. In an era of segregation, this was revolutionary. Black patients who had been denied treatment now had a place of dignity and care. But no one knew. History was about to walk through its doors. July 9, 1893. A young man named James Cornish was rushed into Provident Hospital. He had been stabbed in the chest. Doctors believed the wound pierced his heart. At that time, heart surgery was considered suicide. The medical consensus was clear. The heart cannot be operated on. But Cornish was dying. Williams made a decision few would dare. No antibiotics. No blood transfusions. No advanced anesthesia. Just skill, courage, precision. He opened the chest. He located the wound. He carefully sutured the pericardium, the protective sac around the heart. The room was silent. Minutes felt like hours. And then, the bleeding stopped. The heartbeat steadied. James Cornish lived. He would recover and survive for years. This became one of the first successful open-heart surgeries in American history. And it was performed by a black surgeon in 1893. Because history does not always tell every hero's name. After that surgery, Williams gained recognition, but not equal recognition. He later became chief surgeon at Freedman's Hospital in Washington, D.C. He helped establish what would become the National Medical Association, created because black doctors were barred from joining the American Medical Association. His mission was bigger than surgery. It was access. It was dignity. It was opportunity. He wasn't just healing bodies. He was healing a broken system. One mistake and critics would say, "See? He was not qualified." One success and they would stay silent. Yet he operated anyway. Because someone's life was more important than his fear. But here's the twist history rarely mentions. Some medical historians debate whether his surgery was truly the first open-heart procedure. Records were incomplete. Recognition was inconsistent. Credit was complicated. So the question isn't just what he did. It's why the debate exists at all. Heartbeat sound returns. When pioneers break barriers, history sometimes hesitates to give them their crown. Fade to black. Text on screen. Daniel Hale Williams, 1856 to 1931. Surgeon. Founder. Pioneer. And the next time you hear about the history of heart surgery, ask yourself whose names were left out. For more videos like this, like and subscribe to our YouTube channel.